Everybody knows somebody's there. That this person was pregnant and she's now dead. This woman was pregnant, she's now dead. Oh, I lost my sister, she was pregnant. Everybody knows people who have died from maternal death in Sierra Leone.
Seven years after the end of the Civil War, Sierra Leone is still struggling to rebuild its healthcare system. Even the few relatively modern hospitals are chronically underfunded. Corruption is a problem, and they lack many of the most basic facilities.
Are the relatives around?
One shocking consequence that is often overlooked is that 1 in 8 women in Sierra Leone dies giving birth, as opposed to 1 in 4,000 in developed countries.
Currently, we're examining the woman. We did a Doppler ultrasound examination on the abdomen, and we didn't get a fetal heart. So that means that we've lost the baby. We have to get the blood for her. We have to get at least 2 liters. She's now being resuscitated, and we try to get 2 liters. That means if we need to do an operative procedure, we may need the blood because she's still bleeding.
Although healthcare is supposed to be free for pregnant women, in fact, this is seldom true. Patients and their families are often forced to pay for treatment that they simply can't afford. In a country where over 50% live on less than $1 a day and a quarter live in extreme poverty, the poorer you are, the more likely you are to die giving birth.
You know how many days that woman that's in the office in Panama? Or for say, when they say 150, I help you. If you can't tell, we thank you. So if you need medicine, now your own business, that money, you don't even do for pay the people that are theater. Go try for paying blood for the woman. The woman, you lost beaucoup blood for put that in there. And right now, you need blood, you need a medicine a day. They need blood. I don't tell you. Not go over again. I say go find blood for them. So strong man then we will give blood. Then go pull blood power, then go give the woman. You understand?
We need a lot of financial help. We need a lot of help with building these infrastructures. Hospitals must be built. We must have proper theaters, like I said before. And then we tackle the personnel, having trained, qualified medical workers in every aspect. We need proper blood banking system. Some hospitals do not have proper water supply. Some hospitals do not have proper electricity or constant electricity supply. I look at it as a gross violation of women's human rights. We lose so many people.
Although the government recognizes the problem, its critics believe that they are not doing enough to prevent so many pregnant women dying. For many years, Issa Cole has campaigned to raise awareness of the problem, and like many women in Sierra Leone, has lost a close friend in childbirth.
Adama started bleeding. She went to the midwife, where she went to deliver. She delivered the baby and started bleeding.
Adama died, and her aunt Sarah is now struggling to look after the baby.
We born now, the baby been big. Then first time for leg born, so the baby been big. So we can born now. They say 9:30, 7:30 to 9 now. It changed. It begin bleed. Then wash with her and can't go now my soaps. Before then they reach my soaps now. Now they died.
I think she was feared of not having money. And she was feared because of the bills, because they already told her she's going through an operation. She didn't have the money and she didn't know where she's going to. If she borrowed the money, where should we get the money back to pay the person?
Women are faced with an impossible decision, whether to seek help from untrained midwives or to try to go to hospital knowing they can't afford the treatment.
I get belly. The belly at me 4:30. So as I wake, bleeding begin come up at me. I begin bleed till 8. So we go to the hospital and see operation. Money no dey. So I'm able again. I just dey bleed no more. I just can't born the pikin now. The pikin sleep one day, make it 2 days, he die. If you go hospital, you don't get money, they die. If you give half money at the hospital, then they hold and they say, "Pass, you full up the money, you they die." If you not to God, would this me auntie, me like I don't die. Then give me the word and say, "I'll go." You cannot get the money for pay, all the money. Me auntie they cry, they go and let money not day. And the money now they cause this problem, oh they die at this country, the money.
Sierra Leone is divided into 13 districts, only 7 of which offer even basic emergency healthcare to pregnant women. Limited road access and poor communications makes it often impossible for isolated communities to access medical services in time. Al-Hassan's son, Sana, was only 3 years old when his mother, Hava, died giving birth to twins. Like many women in Sierra Leone, she lived a long way from hospital and couldn't reach treatment in time.
A woman will be married or for explain given, I want to understand. He been left Pambon last year, March, in the 19th. Me to me woman, what you been between you, not been getting no paraba. Less the sick, the belly way been done sick, no you born. Left Pambon.
Al-Hassan has never recovered from Hava's death and regularly visits her grave.
That woman die one really usa sidon so. I get that he the heart.
Although Hava did have access to a local maternal health center, Anne-Marie Starks, who runs it, works all alone and has just 2 years basic training.
Hawadabo was my patient. She was attending the clinic regularly. So when she came to my center to join clinic, I advised her that you are a previous cesarean section. You have to deliver at the government hospital. Your case is very serious. So what she was coming, attending the clinic always. By the time now her labor started, they didn't come earlier to the center. They come late. And at that time, I tried to refer the patient, but there was no vehicle, no way. So suddenly, she passed away.
Another family torn apart by the death of a mother is Kai's. Her daughter Adele died because she was not referred to hospital in time. Kai now struggles to look after her grandchild and is driving her family deeper into poverty.
Now they beg no more. And Papa no day. Now me hungry no more. If you don't know, if you say today no they sleep, no they sleep. Now so they go now. Oh now, if I left family, I solve the confusion. Yeah, they beg no more. Let them help me. They beg no more.
What's in Aden's age?
18 years.
18 years. Aden's age is 18 years. 18 when she died.
Adele's baby is now 4 months old and seriously malnourished.
Adele was supposed to deliver and the baby was expelled. The TBA resuscitated the baby and the baby was saved. But the mother was suffering from bleeding, severe bleeding, which is postpartum hemorrhage, and retained placenta. This retained placenta led her to death.
Many women still rely on untrained TBAs or traditional birth attendants. They are found in every village and community throughout Sierra Leone and offer a cheaper alternative to the modern healthcare which the government promised would be free.
It's totally free. It's totally free. It's free. Kuburan is.
Dr. Bundu runs the Makeni Hospital. He believes that there are three main reasons for the death of so many pregnant women: the delay in seeking medical care, the delay in reaching a hospital, and finally, the delay in receiving adequate treatment when they arrive.
One of the reasons for forced delay might be the fear in the people that they are going to be asked to pay in the hospital for services. They go to alternative sources who are not trained, but they have the confidence of the local people. Nationwide, if we do it by district, Bombali has the lowest maternal mortality, thanks to massive support from the reproductive health sponsored by the UN agencies, like UNFPA. They are giving us drugs, they are giving us surgical sundries, and they are giving us incentives so that to motivate the staff and work effectively. They don't have to pay for care.
Dr. Bundu's hospital is the exception rather than the rule because he receives additional UN funding. But most other hospitals and health centers aren't so fortunate. Janet and Fatmata run a government health center. Without proper funding, they face an uphill struggle to encourage women to come to them for treatment.
So many pregnant women come here for antenatal clinics. They come for checkup, they come for examinations. We used to give them their routines. Of course, some don't come because of ignorance also. Some usually say we don't have money. But as long as they are pregnant women, we used to tell them, come, even if you don't have money.
Some even refuse to come again, saying, I don't have money, unless you go to their houses. And okay, come and let's go.
Come, let's go. Come, let's go. Mm-hmm. Go for your drugs.
I've not been paid for the past 3 years now, almost. I've not been paid a single cent. Well, I've been surviving through patients by the little amounts they give after buying drugs and stationaries. What is left we use.
Healthcare is supposed to be free, more for pregnant women, under 5s, and vulnerable people. But we used to ask for money because we are not paid. Sometimes, whenever they don't have, we treat them just to save life. We know we are fighting to save 2 lives.
Tired of seeing so many women die and tired of waiting for the government to act, communities like this one have set up their own savings scheme to cover the cost of emergency maternity care.
Okay, and the people and the police there, now the meeting don't start. If anybody talk, I mean, anybody make side talk, then picking let them come on here. Anybody will not get please? Let them come here.
While the government is encouraging schemes like this one, for people who have so little in the first place, this is an additional burden they can ill afford. The real answer is for the government to act on its promise to provide free healthcare for all pregnant women. Dr. Samuel Kabo is the director of the Reproductive Health Program at the Ministry of Health.
Before the war, we had about 500 to 600 doctors working in government. After the war, we had less than 100. They all went away because of the poor salaries. So what we say, what do you want to do? You improve the salaries and a lot of them will come back. Some of the staff are so poorly paid. Some of them do not get a salary at all. A lot of them are volunteers. And so where they depend, or what they depend actually on, is what they get out of their work on a daily basis. When they go, what patients pay them, that is what they depend on. I'm a doctor. In the district where I was working, there was a time I was the only doctor for months at a time. I was the physician, I was the surgeon, I was the pediatrician, I was the public health surgeon, I was the administrator. And then you are so poorly paid. And then you ask me if you will not want to have these people pay you so that you can be able to take care of yourself and your family. So this is important for us. In as much as we want to help the hospital, we want to help the women directly, but I think one of the ways that we can help them is that if we can get these staff well remunerated, then we can have a hold on them, have them accountable to us, then they can be able to deliver services.
But the question remains, why isn't the government prioritizing women's health when most of those who die giving birth in Sierra Leone could have been saved with the necessary care? Women like Issa Cole want the Sierra Leonean government to take steps to ensure that all women enjoy their right to life.
The human rights has to come in at some places, as well as the government need to come in also. We ourselves, the women, need to advocate for ourselves that we are suffering. We are dying because of lack of knowledge. We are dying because we are poor. We are dying because it looks as if there is no one that is hearing our stories.